Mesdames et messieurs, bonjour, bonjour.
Ladies and gentlemen, hello, Hakim.
Bonjour, Zako, bonjour.
Hello, everybody. Ladies and gentlemen, I'm the coordinator of program for Pathfinder in Niger, and I welcome you to this session about sharing experiences about the contribution of religious leaders in order to create a favorable family planning environment using modern methods of contraception in Niger, and especially in one of the intervention areas for Pathfinder. Thank you for taking the time to take part in this important exchange, and we hope to learn from you too through your various questions that we ask you to ask as we go along during the presentation. Do not wait for the end, but they will. You can use the chat box for that. Thank you, ladies and gentlemen. Our main presenter today is Mr. Assani Akim. He's specialized in community services and has 15 years of experience in activities in reproductive health and teenager health, and also community services in Niger, especially in this region that we are targeting today. So please welcome Mr. Hakim. But first, I want to say that this webinar has simultaneous interpretation in both English and French. So please use the interpreting channel in order to get to listen to the language you want in order to follow everything that's being said today, depending on whether you prefer to listen in French or in English. Thank you. And now I ask you to welcome along with me Hassani Akim for his presentation. Akim, you have the floor. Thank you for this presentation. Ladies and gentlemen, good morning, good afternoon, or good evening, depending on where you are. I'm very happy to exchange ideas with you in our series of sharing about involvement of religious leaders as partners in family planning activities in the Tahoua region in Niger. There is a contribution of religious leaders in order to create an environment which would be useful and helpful to develop the use of family planning products in the region. Next slide. My presentation will be focused on these 8 issues. After the introduction, I will share the goals assigned to this presentation, the intervention area, the duration and the funding, support and methods that we used to implement this intervention. We will share some results with you, results of the implementation. And we'll talk about challenges we have met, the lessons we have learned, and we will conclude this presentation. Next slide. So as an introduction, I want to say that in a context where social and cultural constraints have strong influence on the perception and also the practice of reproductive health in the communities, religious leaders played a major role in promoting sexual and reproductive health for young people. Religious leaders are people who are listened to. They are educators. The interpreter apologizes, but the sound is very bad. And they try to make sure that the parents play a positive role to help young people use these methods of contraception. However, religious leaders are involved in activities concerning family planning and reproductive health. They can give information, provide data, and indicate what is mentioned in religious documents. And the family planning with modern method is accepted and supported by certain texts issued that are part of the Quran or Hadith of Islam. Many questions and controversies occur in some communities, and there are some preachers who are opposed to family planning and they intervene in some villages targeted by the Impact 2 project. So it is in this context that Pathfinder set as a goal through their intervention to create an environment, a positive environment for the use of reproductive health and family planning through the involvement of religious leaders in intervention of the Impact 2 project in the Tahoua region in Niger. And more specifically, it was about developing and validating religious argument on reproductive health and family planning and gender in Islam to strengthen the capacity of 46 religious leaders in the Tahoua region on the themes described in the document that was developed, raise awareness in the communities through preaching focused on demonstrating that Islam can be used to support family planning and reproductive health and responsible parenting and gender issues, and support community intervention of the Impact 2 project in all the villages targeted for this intervention. This intervention took place in the Tahoua region, which is indicated in the center of the map that we see on the slide here. And in this region, there are three health districts, Keita, where 21 religious leaders were trained, the Buza region, where 15 religious leaders were trained, and 9 leaders were involved in the Madawa region. And on regional level, 1 supervisor was trained for this intervention. This intervention was funded by the Gates Foundation, and it lasted 2 years, from December 2019 until September 2021. So the process for implementation of this intervention took several steps. First, there was a first step which was used to develop and validate arguments on a religious level to show how we could talk to religious leaders by using the Quran and Hadith, which support responsible parenting, some gender equity issue, and other themes associated with reproductive health and family planning. And then we targeted a number of religious leaders in the intervention area, and their capabilities were strengthened on the various themes that we just mentioned in connection with Islam. And then there were awareness sessions that were organized for religious leaders by preaching in various villages targeted for this intervention. Next slide. The development and validation process for the development for the argument based on religious tenets started with the recruitment of a religious consultant who was specialized in health issues. So it is a religious leader who is very experienced in family planning and reproductive health issues, and it took part in many meetings on issues of the role of Islam in supporting family planning. So this consultant worked with regional consultants in order to develop a draft document for this issue on Islam and family planning, responsible parenting, and gender issues.
So this draft argument was severely criticized, but also reviewed by religious leaders. And those religious leaders from different districts got together and went over together this document and to bring together comments and arguments based on this document. And also bring a context to the translation of these the Quran writings. So this validation process was also reviewed. It was also took place with health leaders to bring further information based on health. And to make sure that the themes are adapted and well understood by the religious leaders. And so the final step of this process is about translating this draft argument in French, but also in Ajami, which is the Quran translation in local language, but written in Arabic. So this allowed to federate or to gather the understanding and make sure that the process was mostly inclusive, and ended up with a consensual document that would represent some guidelines for this process. Next slide. So what is the targeting of those religious leaders? It took place with through different steps. So there was a working session with an influential religious leader in the Tahoua region who knew already the different district religious leaders who would be able to contribute and bring awareness of family planning by using the Quranic writings. So this religious leader was made aware of this process and was given information about the previous interventions. And after that, there was a targeting. There was a targeting of an influential religious leader at each district level. So the 3 districts. And so we were able to identify 3 of those. And so this brings to the 3rd step, which is basically the communication in village assemblies to explain the approach in each village and also recruit other influential religious leaders in each village. So those are people that are that people listen to, that are close to the people, and they become resources in each village. So those leaders were recruited in each village. Next slide. So next was the capacity building through the upgrading of a pool of trainers, which is basically made up by the religious leaders, but also on the regional and district level. So those benefited for this capacity building at first. And then there was a cascading theoretical training for village religious leaders at each health district level in local languages. And those training enabled simulations of awareness sessions in local languages. And after each training, each religious leader was provided with a sales pitch, religiously based, obviously, with the Ajami version, so that they can bring awareness to the populations and by using the documents that they have. Next slide. So how did it work? How did this awareness training work? Usually it starts with the community mobilization on a village level. So maybe be starting with DBC agents or health community workers or somebody or the public representative. So that way, the population is being informed as to where the time and the location where things are taking place, so that they can show up and they can start the activity. The next step is the installation of participants on the location indicated by the head of the village. Usually it's in front of the mosque. And this is where we can set up everybody, men, women, children, etc., with all different categories of population, and the entire population and community that gets set up over there. And then the conference or the debate with the different themes, which is facilitated by the religious leaders on the different themes that were mentioned. And those sessions, those preaching sessions, are being supervised by the religious leader of the district or of the region. Next slide. So this process was being supervised on a quarterly basis by a joint team. So notably a Pathfinder agent, also a religious leader who is a trainer. Usually it's on the regional level. And that way, data was collected on a regular basis, and the data were being processed and transferred over to our follow-up team to evaluate the sessions and the process. Next slide. So, ladies and gentlemen, now we're going to go over some of the results that were drawn from this experience in Niger. And let's get started with capacity building. There was an upgrading of 4 regional religious leaders, trainers, who were more capable than others and more competent to provide training in family planning, based on a purely religious leader level. Those trainers were being given additional capacity to help on the district level. Then there was a cascade training of 42 community religious leaders on RHFP, and responsible parenthood and parenting and gender from the Islamic religious perspective. Next slide. So this capacity building enabled or showed significant improvement in the level of understanding of trained religious leaders on RH and FP, because they're basically bridging a gap between health and Islam. Most of those leaders, those 42 leaders, were being given an Islamic religious argument in Ajami, and that enabled the capacity building in their region. Next slide. So here are some results. So here, with some numbers here, 46 religious leaders that were trained, and also 8 campaigns, awareness campaigns that were led, especially on responsible parenting and the gender in Islam, And this awareness training targeted 110 villages. And in those in those 110 villages, over 15,000 people were participated. 53% of them were women and 47% were men. Next slide. This approach in the Tahoua region allowed some health managers to come up with this statement. So basically regarding this preaching session, it is one of those Pathfinder strategies that has been most important to me because it is a zone of significant religious influence. I will tell you about a village where populations were really fundamentalist. And to talk about family planning was really challenging. And in other villages, there were populations they flatly forbade us to enter. But thanks to those campaigns, those awareness campaigns, we were able to meet with the village marabout, and especially Malam Mustafa, who's a religious leader of the district in Keita. And thanks to whom this awareness went from marabout to another marabout. And from now we have agents that are capable of rolling out this model. And they were finally convinced by the verses of the Quran, and it was finally accepted by the entire community. So this is a very powerful community testimony to show the impact of the approach on the population, on the targeted population. Next slide. So, of course, during the implementation of this approach, we met some challenges. It all started during which Niger faced the pandemic, COVID-19 pandemic, with significant barriers that were implemented by the government. So especially social distancing. So getting together was prohibited in the villages to avoid the propagation of the virus. So that was very challenging, of course. Then there's also the persistence of basically fake news or rumors, negative rumors on family planning in some villages, in spite of the awareness campaign that we performed there. So there were some rumors that kept spreading on family planning. The Tahoua region is a significant exodus area. So some men see or experience or perceive family planning as a way for women to cheat on their husbands. So that was the perception as an incitation or as an encouragement to cheat on their husbands because the husbands are not around, and so they think, and so family planning is just not relevant to them. Next slide. So what were the lessons learned here? So this approach to creating demand for family planning by religious leaders was decisive and complementary to the community-based interventions of Impact 2 project in the Tahoua regions. It all started in 2019 with an intervention package on the community, but also in the different health system strengthening. So with this campaign by religious leaders, it enabled a very favorable environment to express and to facilitate other interventions in the Tahoua region.
Oh, sorry. So there were many religious leaders who understood the Quran, and their interpretation of the Quran was such that it was not a favorable interpretation for family planning. But because of this strengthening of capabilities and improvement of skill, they understood that the sense they gave to these verses was not totally correct. And so they were able to raise awareness about this and change the interpretation of these verses. And this enabled them to understand differently the issues of gender, responsible parenting, family planning, and reproductive health with the help of these Quranic verses. And the involvement of religious leaders in these interventions enabled us to fight the taboos and unhealthy rumors about family planning. To conclude, I want to say that direct exchanges with population and family planning seen under the religious angle with the support of duly trained religious leaders for this was a very good way to promote acceptance of spacing births, which helped with health. And this preaching was done on family planning, responsible parenting and gender were very beneficial because enabled people to better understand the recommendation of the Quran verses and the hadiths on these sensitive themes and to go against taboos and unhealthy rumors, and enabled members of the community to better know their responsibilities and space births in order to preserve health in the long term. So, ladies and gentlemen, this is what I wanted to say. So I finished my presentation. I want to thank you for your attention. And now I'm ready to answer any questions, contributions, comments after this presentation showing my experience that I shared with you. Thank you very much. I'll give you the floor. Thank you, Akim. Thank you for this presentation. It was very enriching. Right now, I don't see any questions so far in the chat area, but maybe if you wait a couple of minutes, we'll have some questions. And also, if you prefer to raise hands and activate your mic or use a chat box, whatever you prefer, you can ask a question in either one of these ways. But right now, I don't see any questions. All right, if there are no questions, we can close the session a little earlier than expected, but I do not want to cut short too much in case some people change their mind and have questions. I have a small question. Is there any project which impressed you, Akim? Something that maybe it was not anticipated, something that impressed you regarding the work you have done? Yes, of course, there have been a number of things that were impressive. First, when we invite religious leaders, we are fundamentalists around a round table to talk about issues connected to the verses of the Quran or Hadith and the interpretation of immediately you can see that there's reluctance or lack of trust because anything that has to do with the religious issue is a dogmatic issue. It's an issue about which we do not think that you cannot give your own opinion because you risk misinterpreting. But what's impressive for us was how people were enthusiastic, those religious leaders accepted to take part in this experience and to understand that in fact, many of them were in the dark, they did not understand what they were trying to interpret. And this was determining, very revealing for us to help us develop and further this approach. And we are able to understand that in villages, there are many religious leaders who read the Quran and think that they know how to interpret the Quran, but in fact, do not know the Quran very well and the real meaning of these writings. And you could read that, would discover that it was very interesting, and they were they're able to rediscover the holy book, and they understood how they could use it to raise awareness of the community about the various problem of family planning, reproductive health, gender issues, and responsible parenting problems they have in the village. These problems exist. So it was very interesting to know that the Quran had already discussed these issues. It was a new way for them to read the Quran and to learn that. And this was very important and promoted improvement in this way. Another thing that was important in the implementation of this experience was the fact the approach we adopted, in fact, in order to reach religious leaders of the village. We used an influential regional leader, well known in the area, in the Tahoua region, and this religious leader was very influential on an even national level. And he's a scholar as far as Islam is concerned. And this person enjoys notoriety. How would I say? He is well known, and people trust him. And the members of the community and his peers really trust him. In various villages, religious leaders consider him as a guide, someone who is very well, was enlightened, knows the Quran very well, and is a real scholar. So it was very useful to use his services because the person was convinced of that what we're doing were good and not incompatible with the Quran. So it was very good that he helped us legitimize this approach, and because he had the trust of local religious leaders. So not only those who are already favorable to family planning and reproductive health issues, but also the ones who opposed it. So there was sharing of experience. Many examples were given and enabled us to strengthen capabilities and enlighten a local religious leader at the community level. And this helped us raise awareness in the community, in the population that benefited from that. So these are aspects that have been noted about our approach. And the last thing I want to say is that the health system, with the people in charge of health issues, was expecting to see approaches based on a religious leader who have influence in their areas, in order to not only raise awareness among the population, but also create an environment that promotes the services of reproductive health and family planning. So with this approach that we just developed in the various districts of the region, we saw with the help of various doctors in the district to show that, in fact, we were able to find solutions and resolve difficulties that had been noted before. Because of the health teams goes to a village to provide services, sometimes it was chased away by the local community. So we have to avoid this. But if later in the same community there is a religious leader, a marabout, who says what you are doing is not right, this is what Islam says, this is what the Quran said, and then you give credit to what these health agents come, and that would make it possible to provide health services in these various communities. And this is why health personal health member of the staff was very happy to see this approach we had used. So this is what I wanted to say as things that shaped our development of this policy. Thank you very much. Thank you. And we have one question in the chat box. Niger, with the support of its partners, developed a family planning argumentation and connected with what Islam says. And where are we about the vulgarization of this document and its ownership by the Ministry of Health? That's a very good question. The ministry developed an argumentation on a national level, focusing on family planning, and I think it is an argumentation, a thesis that took into account our experience and the experience of other partners, like CSI and other partners who intervened to develop a national document that would be validated by influential people in order to raise awareness and make it possible to provide reproductive health and family planning services. So this document exists, and this document was validated, and it is in a process of being adopted progressively, and we are working and putting it to scale, expanding it in most of the areas of our intervention region. And I want to repeat that the process of development of this document was piloted by the General Directorate of Health and Reproduction at the ministry. It is that agency that developed and led the development of this process, and this enabled us to promote and to show the ownership of this process by the various stakeholders at the ministry and on the regional level, and most partners who intervened in family planning. And so the General Directorate of Health and Population at the ministry was able to do a lot to help us to show that influential people owned the project and supported it completely, including religious leaders.
But the use for a family family planning services delivery just happened that way. So this is what I can add with regards to the document that we developed and that we were part of. And so those were my those were my concluding words. Thank you so much. I don't see other questions that came in the chat box, but we will share the recording of this webinar and also what was provided last week. I would like to thank you and everybody for this participation. That series of webinar was really interesting, was fascinating, and thank you, Akim, for your presentation for today and the week and the previous weeks, and for sharing those amazing experiences. I want to thank everybody that's present today. And I hope this is not the last time that we get together. Thank you so much, everybody. Thank you so much, Anna. Thank you for your presence. Thank you for sharing this experience. The interpreter has a hard time hearing the speaker.